Hello everyone, my name is Nopiwe Job and I'm from Digital Medic. Digital Medic and Chic collaborated to create a digital advocacy training course for community health workers. We did this using a design-based research approach where we recruited 25 community health workers from 8 countries to serve as an advisory group. One key feature of design-based research is that it allows the research participants to collaborate in the research. So not only were the community health workers an integral part of the curriculum development, but we were also able to observe how their perspectives about workplace advocacy evolved throughout their 6-month engagement with the curriculum. This is what we learned. Firstly, we learned that the community health workers entered the course having an understanding of advocacy and fully perceiving themselves as advocates for their communities. Their understanding was mainly rooted in the idea that the one who advocates does so on behalf of others, describing it as giving a voice to the voiceless. The second thing we learned was that there's a moral conflict between advocating for themselves and their working conditions and empathy for their community and their employer organizations. The third thing we learned was that the community health workers, with more engagement with the curriculum, began to identify themselves as part of a global cohort of professional health workers and realized or recognized their ability to uniquely advocate for themselves and their communities. Lastly, we found that the community health workers embraced their roles as advisors, and they reflected positively on their influence on the course creation. In conclusion, we think that our findings suggest that any efforts to engage community health workers in advocacy must first overcome the systemic barriers and norms that are internalized by the community health workers themselves, particularly their moral conflict with self-advocacy. Read our paper to find out more. Thank you.